Like it. Can you hear me okay?
Yeah, yeah.
Okay. Awesome. Awesome. We're live.
Oh, okay.
We're live. Good morning. Good
Good
afternoon. Good
morning.
evening. Depending on when and where you're watching this Facebook Live, this is the voice and the face of Dr. Olabintan. I'm the CEO and co-founder of Livingspring Family Medical Center here in the amazing city of Mansfield, Texas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. I am honored to be having this Facebook Live with the one and the only Dr. Odunsi. I want to make sure I'm pronouncing that Odunsi. Thank you so much, Doc, for coming. I appreciate you taking the time to do this.
Yeah, yeah. Thank you for inviting me. Yes, I love to talk anything medicine and anything GI, especially
Yeah.
during colorectal cancer awareness month. So
Mm,
happy
mm.
to be here.
Awesome. Thank you. So perfect timing. And today we'll be talking about the topic,
Mhm.
Doc, I'm 45. They said it's time for colon cancer screening. What are my options? For those of you who are watching live, hashtag live. Those who are watching a replay, hashtag replay. Dr. Dusi, do me a favor. Please introduce yourself to our guest. Who are you and what do you do?
Oh, okay. Hi, everybody. My name is Dr. Suwebatu Odunsi-Shiyanbade. I'm a gastroenterologist here in Mansfield. I see patients all over the Metroplex, but mostly in the Mansfield, Arlington, Grand Prairie area.
Mm,
I practice mostly general gastroenterology, seeing all ranges of gastrointestinal disease, inflammatory bowel disease, treating and just basically anything that your gut does. If your gut loves you, I welcome you. If your gut seems like it hates your gut, I welcome you. And then of course we're focusing on colorectal cancer awareness. One of our major procedures is colonoscopy, which is a big part of colorectal cancer screening. um, yeah, I'm from around the Metroplex. I went to undergraduate at University of Texas, did residency at UT Southwestern,
oh,
and trained
wow.
at Mayo Clinic. So, just a wide breadth of knowledge in different places to, you know, help patients, and that's it.
Awesome, awesome. I love what you do, Doc. And I didn't know you were in the Texas area from like.
Yeah. I grew up around here, so I'm, I guess we say, a local girl. I grew up in the Dallas Richardson area, so yeah, it feels good to be back in the area permanently after going all over for medical education. So I've been practicing in this area since 2010, and so I think it's something very important for us not only to have people, of course, dedicated to the community, but having
Mm,
people, who have been around here for a long time, knowing the ebbs and flow of the community is also important.
awesome, awesome. I like what you do, Doc. And a lot of my clients have gone to see you and loved you. I'm like,
No,
of
thank you,
course,
thank you. Well, we
of
love
course.
to see your clients in my office too, and they say many great things about you, including how you push them to get all their screenings, not just colorectal cancer. No, it's true. Primary care has to do it, and we appreciate
Yeah.
you too.
Thank you. Thank you. Thank you. Thank you. So, Doc, why do you do what you do? Inquiry minds want to know.
Yeah, a lot of patients ask, how did you get into this? I love it. I think I was always fascinated by digestive diseases, and then just really in medical school, learning about how the gut works is fascinating to me, and it still is. Um, of course, we do all those things. We also deal with pancreas and liver disease, and so those things are just a big part of our daily lives. They're not as prominent in some ways as other diseases, heart disease, things
Mm,
like asthma, diabetes, things we hear of. So I like patients to feel comfortable with me, and talk to me about those things that ail them that they may not be able to discuss at Thanksgiving dinner. So
mm.
you can come and talk to me about your bathroom habits, or anything really. So yes, I I enjoy it, and I think it's also important to have a variety of people. Ladies can talk to me about things that maybe they're not as keen to talk to other physicians about. We work closely, of course, with primary physicians, internists, family medical medicine physicians, but also a lot of my patients come from the gynecologist, right? Having a whole woman exam, things like that. So we see patients from the urologist as well. So we see a variety of patients. Cardiologists send us people who have chest pain, but it turns out not to be their heart. Maybe it's reflux disease. So I get to see young patients. I get to see, not so young patients. And I love it. I think it's a variety, and my day is not always the same. I do procedures, and then I might see patients in the afternoon or vice versa.
Awesome. It's clear that you like what you do.
Yeah.
And you could talk poop all day.
Yes.
All right. So my next question is this. Someone is watching this like, why do I have to do colon cancer screening? You guys are always looking for something. Because I've had that, give like, why are you guys always looking for something to be wrong? And I'm like, no, but why colon cancer screening? What's the big deal with that?
I think it is hard. You're right. I think it's hard for patients sometimes to understand, especially with screening, right? One of the benefits of modern medicine is now we don't have to worry about so many of the infectious diseases that, plagued our lives. Of course, the pandemic came and, woke us up again. But colon cancer. That's it. Colorectal cancer is a big killer, and we have to worry about it. The benefit of having a screening is it can become a non-issue. And so it really, the only thing that it takes is time, just a little bit of time for you to, essentially improve your health. So you've, done all the things, you're getting your blood pressure under control, you're doing all these things. For ladies, we know you have to go for your mammograms. Colorectal cancer is actually becoming more prevalent, and interestingly, and unfortunately, we're seeing it in younger and younger patients. And so the idea of starting colorectal cancer screening at age 50 to catch things that would later on in about 10 years, where we used to see colon cancer peak in the 60s. To catch it early, we now see that we have to push back the age to 45. There have been, of course, a few famous people, most notably Chadwick Boseman recently. But even years ago, Katie Couric's husband famously had battled with colon cancer. And so we know that this is a cause of mortality that can be prevented. Imagine that. It can be prevented. So if we can, should we not do everything to avail ourselves of the resources to help prevent this? And so it is unfortunate that it's becoming more prevalent, and we don't know all the reasons why we're seeing it in younger people, but we know we have the tools already available with our doctors. So why not use it? It is preventable.
Awesome. Thank you for that emphasis. And my next question is, when should you start screening?
Yeah.
Generally speaking.
So yes. So generally speaking, you should start screening at age 45. So this is what we call average risk screening. So that's everybody, all comers, age 45. There are people who are at increased risk due to family history or due to other medical conditions, and those people can be guided by me or by their primary physician referring them to me to give more specific recommendations. But in general, age 45 is the time to start screening. Something that I do personally that I think might be helpful to patients is I just make sure that I get my primary care doctor's visits, dentist, whatever else around my birthday, and so when you do that, that at least clues you in. You said, okay, you're getting your, whatever it is, your birthday plans in order, that within this month, you don't have to have the appointment in that month, but within this month, I'm going to do this. So whenever I see patients coming in around that age 45, I tell them, I'm going to give you a birthday present. And, the birthday present is this. is, we're hoping for not just extending life, but health, right? That's what we're really looking for, meaningful years to your life, something that takes just a little bit of time to actually improve your health, because it is preventable. So this is what I preach to my patients.
Awesome. I love that you said adding not just length of life, but quality of life. So meaningful years to our client's life. We want you to live long and well. And so
Yeah.
Doing these things early can help increase the chances of that happening. So,
Exactly.
and I love the birthday gift.
Yeah, this is it.
And I tell clients, I say, they're like, I don't want to do this. It's inconvenient. I'm like, you're worth it.
Yes, I love that. I know, I love that. You are. I mean, we do there's so many things that we don't want to do, I mean, it's just the same thing. Okay, the car is due, right? You have to get your state inspection.
True.
I don't want to do that. I don't. But you do it. You know that at a certain time of the year, you have to do it every year,
True.
sometimes 2 years, whatever it is. You just bite the bullet and do it. So it's the same thing most of the time. You don't need colonoscopy. Most people do not need colonoscopies every year, but there are many things that we do that we reluctantly do. So you're worth it. Do it.
I love it. I love it. So for someone who's watching, who's like, doc, the whole idea of something going up my butthole does not resonate well with me, and they're asking like, what are my options? Yes, I want to get colon cancer screening, but do I really have to have the colonoscopy?
Yeah. Well, it's true. We have to make sure that we reach patients where they are. Okay. And so by the time most patients come to me, they've had at least some discussion with their primary physician. But even if they haven't, we talk about, the options available. There are mostly stool tests. A lot of patients have heard of commercials for a commercially available test called Cologuard or fecal DNA test. There are the previous, what we call FIT tests. These are all stool-based tests. And of course, colonoscopy. Really, I tell patients, do something. And, do nothing is not an option. So I would want patients to do something. Of course, we tell patients about the benefits of colonoscopy because it's the only of the tests. It's the only one of the tests where you can actually remove polyps. So if you have a stool-based test and it's positive or it shows something concerning, you will be referred for colonoscopy. So, but you need to do something. There are some other testing available that is not as easy to obtain and not as easily done as these other two options. There are some radiographic tests like virtual colonoscopy. It's been called CT colonography. It's also called, that's something that can be done as well. So there are some other options, but essentially what we encounter, what most patients will encounter, would be stool-based tests or something like colonoscopy. And we have to take the whole patient into consideration. Are you fit enough to undergo the procedure? It's very comfortable. Many people are concerned about the preparation phase, of course, sedation, and of course, just the idea of somebody, of something quote unquote invasive. I try to put patients at ease, and most of the time, I think they're able to understand the need for it. But when all else fails, the option to do nothing should not be part of it. So anything you can do is welcomed. So, yeah.
I like that. Anything, you do something. You said, do something. Now, for someone who is wondering, who's like, okay, you're giving me a lot of options. There's the stool. I don't like playing with stool. I don't want to do all that. And they're wondering, okay, how do I choose? Now, of course, this is not, we know it's unique to the individual, their family history, their own personal history and things like that. But how do you advise patients to choose? Like, do you tend to say, do this versus this? Like, what would you say to that question? How do I choose, doc?
I think I really have to see the patient and know what their, what their reservation is. Blood based tests are not, are not really, prime time for that. So you have to do, the idea again of having to check their stool. It's you do it at home, obviously. So it's not when they understand the process, most people are able to,
I had a client who said, I will do a colonoscopy. I am not looking at my stool. I will go and do a colon. And I said,
so that's what I mean. They out of those options, they'll be able to find something. But there's also a lot of misinformation, and Google or YouTube can be your friend, or you cannot. And so I do try to lead people to reputable sites and things like that, and that's also helpful. So I tell them everything, and I don't. I do an approach where I don't force or feel like I'm forcing the patients. I don't mind having patients call me back with their decision. Talk to your family and friends. And then when I do have patients who were reluctant, I am very proactive in telling them, now you've done it, tell your coworkers, tell your girlfriends, tell your siblings, things like that. It's not that bad. We practice the kind of medicine where I believe patients would want their family members, their friends, their spouse. We even have spouse do it together on the same day. So, but I believe I have the kind of practice, and I have the kind of relationship with my patients where they would want to bring their family members. And so when I do a good job with that patient and I explain to them, they feel very comfortable to pass it along. And that's what we need. I don't want me to be healthy. I want us to be healthy. We're in a community. And so these are the kind of things that, help patients understand what's going on. But yes, there are some where there's nothing you can say, they will not, and unfortunately we do catch people who have late stage disease because, frankly, they ignore symptoms, or frankly, they ignore, recommendations by their physicians to have regular screening. So there are things where definitely you must have it evaluated. So we're talking about colorectal cancer screening, but we also have to know that some people are actually symptomatic, and obviously that's no longer a screening. But let's not forget that if you're having things like changes in your bowels away from your normal, you're having bleeding away, things like that are away from your normal, you need to be evaluated. Let us discuss it. Let us tell you, this is nothing, this is something, or let's figure it out together. So let's not forget about that. Let's not use fear. Let's have the time. We make time for a lot of things that we don't necessarily want to. So screening is everything, we know, of course, but there are patients who also just frankly ignore their symptoms. And so we have to be welcoming to people where they are, and hopefully get them to a place of better health in whichever form it can be done.
Yeah. And, one of the things I wanted to emphasize too is that, the first appointment is usually a discussion with you. They sit down, they have their questions. And I tell my clients, have your questions ready so that when you see the doctor, you can maximize the visit. Here are my concerns. I heard this. I'm thankful for the internet and Google, but doing a blind search, they usually would tell you what sells the most.
Yes. And also, having a directed search is good, because it does that. But some people are just overwhelmed, by the wealth of information available. So we also have to, I get many patients who are just like, doc, just tell me what to do and when to show up, and that's okay too. So, if you don't want to know the nitty gritty of, the nooks and crannies of what I'm going to do, other than, the safety, everything like that, that's okay too. So, not everybody, is as fascinated by the gut and stool and all these things, as I am. So yeah, that's fine too. You don't have to, but definitely to feel comfortable and know that this is something that is part of the health, blood pressure, all these things like that, then I'm here for that.
Thank you so much for coming. I wanted to highlight something. One of the things that have not recently come up as a suggested cause of the rising trend is the use of processed meats. What would you say to that? I know that's an add-on question, but what would you, because we're starting to see that the WHO recently, not recently, deemed processed meats as a carcinogenic now. So we're talking, your bacons, the hot dogs, and things like that. In your experience and exposure, what would you say to that? Like, how do you broach that topic with clients who are like, oh my gosh, I'm told this, that I
Yeah.
can't eat processed meats. Do you advise that? What do you say?
A lot of patients ask, what can I do? Especially after, okay, oh, you had a colonoscopy, or you have this family history. My brother got diagnosed with this, or anything else. What can I do? We know, even before this, we know, these processed meats, nitrites, different things, have certain risks. Even before we get to the colon, we know about, sodium, salt intake. We know about, just essentially lack of, real food. Right. We know about having access to processed food is often cheaper and more convenient than, fresh fruits and vegetables, access to them, storage, all these things. So we cannot advise patients in a blanket manner. If you work a swing shift and you drop the kids at daycare, or you work, long haul truck driving and things like that, I can say whatever I want. If your lifestyle is not conducive to that, it's falling on deaf ears. And so first you have to assess the patient, and we start with moderation, minimizing, things like that. And truthfully, in this manner, I don't just focus on the gut, because the things most of the time that are good for the gut are good for the whole health. So we try to lead along the lines of decreasing these things and increasing the alternatives, and so you're not going to get somebody who is having large amounts of processed foods, breakfast, lunch, and dinner, has never turned on the stove. You're not going to get them cooking, meals every day. So maybe we start with, why don't you change that breakfast into a fresh smoothie? That might be more reachable, right? Things like that, we have to do it. So the studies can be there, but we have to translate the study. That's where we are as physicians, scientists. We have to translate that into the regular everyday. And so I like to know do you work during the day? Do you work at night? I have many patients who are nurses, healthcare workers, grab and go workers.
Right.
Yeah. So if you are going to grab and go, which things, maybe this versus that. So it's not just the processed foods, the sausages, the bacon. There's a lot of empty calories, sodas, things like that, all go into play. But I tell patients in general, for colorectal cancer screening, family history is important. Men tend to get more polyps than women. Smokers, stop smoking. That's a big one. Other forms of tobacco use as well. And then the third line I say is, there's a lot you can do. I have my part and you have your part. My part is to help, is to encourage you and to tell you which steps to take. And so, let's make some better choices of the things that are available. Somebody that doesn't eat any fruit at all, you're not going to get them to start eating salad for lunch and dinner, but maybe I might get you to stop drinking as much soda to start. Maybe I might get you to add an apple to your daily routine, an apple a day sort of thing. But really, these things are so pervasive in our society that I really feel that they require a more individualized approach. And we try to give that in the time that we have, of course, but we try, and also to lead patients to the right sources and to let them know that, hey, these things are available to you, and you don't have to be perfect. Each day is a new day. Many patients feel defeated, right? I'm not doing this already, so just forget it. Well, you didn't exercise today, but you will wake up tomorrow. You will wake up tomorrow and you will maybe exercise tomorrow. You will not, I don't care if it's Thursday. Don't throw away the whole week.
True. That is true. So partnering with a doctor who will help encourage you in your wellness journey is very important.
Yes. And I know that those are the kind of things you are doing. Your patients are telling me. So
we're trying. But
yeah.
I love something you said, we have to translate the results to the individual. We have to, it's yes, don't eat this, but let's individualize it for an individualized package for that patient. Like what's realistic for them. And instead of saying all or none, meet them where they are and help them. Little steps. This has been very
can't
powerful.
be so cavalier. I think a lot of times, and maybe I did the same too, in my earlier days as a physician. We say a lot of things in a very cavalier. Do this, stop smoking. Do this, do this, do this. Okay, thank you, Mr. Smith, and move on to the next person. That's they'll forget about it. But if they hold on to one little nugget, that might be something. Okay, when you're checking out, when you are at the gas station, anytime you stop at the gas station, no more drinks. You start with that, that's something that patient, because I see them come in with a QT cup. So okay, so let's start with that, so, and then they remember me. I'm the one, that's that doctor that said that. So
awesome. This has been very, very powerful, Doc. And I have people who are watching who are like, I need to make an appointment. I remember my doctor said I had to schedule, but now I'm looking for a good GI doctor who I'm comfortable with, because that's a very intimate part. Friday. Doc, where can people find you?
So you can look me up at gialliance.com, and I'm here in Mansfield. I'm associated with the hospitals right here, and you can make an appointment, and we'll be happy to take care of you, and of course your family members as well.
Yes, she takes care of the whole family. Okay, when it comes to and I've shared your information here, gialliance.com, your Facebook page as well. Thank you so much, Doc, for coming. This was powerful. I appreciate you taking the time to share with our audience this morning.
Yeah, thank you. And thank you for what you do, front lines, seeing the patients and, encouraging them in all aspects of their healthcare journey, not just GI. So I believe in the whole. So I'm happy. But get your screening.
Yes. Thank you. And for all of you who are watching, thank you. Those who watch live and in replay, please share with your family, share with your friends, share with your frenemies.
I like that.
These conversations are important. And if you or anyone you know is looking for a thorough, compassionate, and caring family physician who will help you live long and well, I am she. Have a good one, everyone. And thank you for watching. Thank you so much, Doc.